So when Brad asked me to do this, initially I was reluctant because this is out of my comfort zone. Then I started thinking about our patients that come into the hospital and how they're out of their comfort zone. Some of them are under tremendous stress, their families, they're vulnerable, they're scared. So it was sort of a motivating factor for me to kind of lean into my own vulnerability. My inspiration for wanting to be a social worker started young with my grandparents who were active members of the community in Alliance, Ohio. They did a lot of shelter work and food banks, nursing homes. Sometimes they would go in and, find somebody that didn't have any family or anyone and provide clothes for them and just socialization. I chose this profession because I wanted to make a difference in people's lives and continue to want to make a difference. I want to help people overcome their challenges, motivate for change, and help people find meaning and purpose that's somehow been lost. I love working as a medical social worker because of the diversity. You can see anywhere from a newborn to a geriatric patient. Unfortunately, sometimes that newborn is positive for drugs, or the special care nursery where mom and baby are admitted to. So I also see patients with new cancer diagnoses, depression, food insecurity, homelessness, alcohol and drug disorders. And how I try to inspire hope, what's something very important to me is providing a safe, supportive environment for the patient, a cathartic space for them to express their thoughts and feelings. And I do that with lots of empathy and non-judgmental listening. It's not easy for someone to delve into the intimate details of their life with a stranger, especially with our alcohol and drug patients. There's a lot of guilt and shame involved. So empathy for me is key. I also try to explore what barriers might exist. Could be mental health, could be unresolved trauma, and their readiness to change. Or if someone's having difficulty managing their health, this could be an older adult, I explore with them their living situation, what kind of support do they have, do they have an untreated mental health diagnosis, do they have a good understanding of what their medical diagnosis is here in the hospital. And it's always a team effort with everyone collaborating for the best possible outcome. The nurses work 12 hours with their patients, and so they are able to build a rapport. The patient feels comfortable with them. So the patient may be struggling with grief and loss that's affecting their health, or domestic violence, isolation, depression, that otherwise might have gone unnoticed had it not been for that nurse or x-ray technician or environmental nutritional services, whoever that patient felt comfortable enough to confide in. And then it's referred to. So then once I can identify that there's a need, then I try to make a referral with appropriate agency. And working in a rural hospital, resources are limited, so establishing good relationships with our community agencies is very important. Some of the agencies that we deal with routinely, Butte County Behavioral Health, where they assist us with our mental health patients. Passages, which is an adult resource center in Chico. They provide in-home counseling for some of our patients suffering with depression. They can't get out of their home. They live in Paradise or Magalia. Butte Baby Steps, so they provide mother and baby support, Youth for Change. The tourist shelter we utilize a lot, which is the overnight shelter. And and then our own local shelter, Shore, which is a day shelter here in Paradise. So it sounds like a lot, but it is limited on what they can do, so we always have to be creative on what we do. And we also utilize our Feather River Hospice quite a bit, for wheelchairs and clothes for some of our patients. And I guess an example of having a good relationship with our community is we did have a patient that was here in the hospital for quite a while. She was unable to return home, no support, functional decline, alcohol abuse, mental illness, and was declined by all skilled nursing facilities here locally. So we referred out to over 300 throughout the state, and she was declined by all of them. So we went back to our own community and back to one of the skilled nursings and really just sat down and sort of worked this out with them, and they were able to take her, and that's where she's going to live. And we had another patient who was struggling with her medical problems, mental illness, and she also had a severely demented mother that she was taking care of with very erratic, violent behavior. And she was at her wit's end. She couldn't do it anymore. And one of our Feather River Health Center case managers, took it upon herself to do whatever she could to get her mother into one of the local skilled nursings here. So, which was wonderful. She had to come to the ER. So it's positive. And as a team, I think we must face that there are and will be times that regardless of the work that we do, how much we do, that we may not motivate change. When we do the best that we can, we never know what miracle is wrought in our life or the life of another. And there's so many wonderful people in healthcare settings that each day quietly go about their work with care and compassion, and who touch the lives of patients and coworkers alike in so many ways, yet don't have any idea the impact that they are making or may have in the future. Just keep that in mind. That's it.